All right, class, time to have a little bit of fun here with one of my favorite drugs, and this is definitely my top shelf. So we are talking about today, if I can get it to pull up, and that would be Midazolam, commonly more known as Versed. And if I didn't choose that drug life, of course it drugs me. And if somebody taking Versed, probably looks like that. So again, the Versed is the main drug that we call it. They do have some other names for it, but again, Versed is the commonly used one. It is a short-acting benzodiazepine. So again, not a narcotic, but it produces a sedative effect, a hypnotic effect. It helps with seizures, anticonvulsive properties. Again, very potent sedative. With that being said, the good news is we give this usually before surgeries, and again, you don't remember anything after it. So again, it affects the GABA receptors. Now, it's kind of important because we got to remember that pediatric patients don't have as many GABA receptors, and we'll talk about that here in a little bit. So again, a lack of recall for about 20 to 30 minutes. You give this stuff, they will forget what happened. So again, it induces sleep, depresses anxiety. It's a really good calming drug, very good sedative. Now, it's got its drawbacks, and we'll talk about those here in just a second. Usually onset's about 1 to 5 minutes, and I'd say probably the 1 minute. Again, it usually lasts for 2 to 6 hours. In the system, effectiveness is probably around the 30-minute mark. And again, it is highly, highly, highly dose dependent. So again, we use it for seizures. We use it for a little bit of pain control. And remember that it doesn't really have analgesia. It more is they forget that they had the pain. And we use it, again, for RSI. It's one of our bigger uses for it, and then in the sedation for an intubated patient. So once we have them intubated, we use that to maintain their sedation. So again, some of the big things that happens with this drug is it drops blood pressure, and especially when you give it fast. So if this is the drug that you really want to give it slow, and the reason is you don't have the hypotensive effects when you do that. But if you sit there and you slam it, their blood pressure is going to drop. A lot of these CNS effects, it's kind of the effects that we really want it to have, except, of course, seizures. It's kind of rare, but they do have sometimes seizures. Every now and then you get one that when you push it, they get the reverse the agitation from it. So you got to, again, be careful of that. The headache, blurred vision, that's kind of a normal thing that you get. Respiratory depression is a big one that happens. And every now and then you'll get a patient that when you give them Versed, they'll actually start to have a laryngospasm. So again, a very difficult thing. It doesn't happen too often, but the respiratory depression definitely happens a lot. The reason you get a lot of nausea and vomiting usually is because you've dropped their blood pressure. So again, give it slow, really slow. There can be some pain if you give it, especially if you give it IM, there'll be a little bit of pain to it. Again, if they've got acute alcohol intoxication, probably want to stay away from this. If they have low blood pressure, they're not circulating good, Versed's not our drug of choice. It's going to drop blood pressure. It's going to relax the patient. It's going to dilate out all the vessels. Don't give it. Again, if they've got any type of glaucoma, you want to really be careful when you use it. And if they're pregnant, you definitely want to be careful with that. It's not a complete total contraindication, but again, you really got to be careful. You can drop that pressure really bad. And especially if they're already on some type of CNS depressant, alcohol, droperidol, any of those drugs, narcotics, it accentuates the effect. Matter of fact, that's sometimes why we kind of give a narcotic when we're doing an RSI to kind of help the Versed work better. Again, with that being said, it's 3 times more potent than diazepam is, so it really works really well. And again, respiratory depression is our big one. Again, if they do have respiratory depression, we don't want them to have it. Again, romazicon is your antidote, but with given romazicon, you should never ever give romazicon and Narcan together. That's a really bad thing, especially if they go to seizing. It's really hard to stop it at that point. Again, debilitated patients, I would give a whole lot less. Older patients, liver disease, I would probably give a lot less on this patient. Again, not generally used with seizures. we do use it for seizures. It has a short-acting effect. Sometimes Valium works a little bit better. It's kind of a paramedic discretion thing there. And again, pediatric doses, they are higher due to they have less GABA receptors. The drug, you're going to require a lot of Versed to stop a child's seizure, a pediatric seizure with this. With that also being said, you're probably going to put them into either respiratory depression or respiratory arrest when you do it. All right, titrate it to effect, especially general anesthesia. 0.3 to 0.35 milligrams a kilogram. Usually a lot of people will start out with 1 milligram, then slowly work up, half milligram, until you get the sedation effects that you want. RSI, I know we teach 2, 4, 6. Really small people 2, medium people 4, big people 6. And if you do out the dosing of it, it's actually a pretty close approximation for that. But again, usual IV dose is 2.5 to 5 milligrams, slow IV push. Give it nice and slow. Again, pediatric patients, I can tell you right now, most of the time you're going to have to go to this higher dose. Go off of, again, what your length-based tape says to do, but you're going to look at your length-based tape and go, wow, I'm going to give this kid a whole milligram for it's okay, because again, they don't have the receptor sites. It takes a lot more in order to get them to do that. We can give this IV, IO, or again, IM if we need to. Intranasal is another route that we can give this drug. Matter of fact, intranasally, especially when you have a seizing patient, intranasal is the way to go. It can cause adverse effects on the human fetus. So again, if they're pregnant, stay away from the Versed. All right. And that's a very true statement right there. Midazolam, it can solve a whole lot of problems, especially if they got a high blood pressure. It'll solve a whole lot of problems. So that, again, guys, is Versed, and we will see you next time.